Welcome back to Your Health Matters, brought to you by Kingman Regional Medical Center. We're talking today about sleeping disorders, and my guest is Mark Hopkins from KRMC's Sleep Lab. It's good to have you on the show, Mark. I'm learning a lot. So if a person thinks that their spouse is telling them they have a sleep issue and they want to get into the sleep lab, do they need a doctor's appointment or referral to do that?
Yes, they do.
Okay.
They could either go to their family physician,
Okay.
and he can refer them directly, depending on the insurance. But most insurance will let you refer directly.
Okay.
Or they can go straight to a sleep board specialist like Dr. Matheny.
Okay.
He's boarded
Here
in
at
sleep.
KRMC.
And then he'll make an assessment and send them to the sleep lab.
Okay.
Or they can call myself, and I can give them direction too.
You kind of guide them through the process, what
That
they
is
need to
correct.
do. And
Yes.
what number would they call?
They can call 928-692-4144.
692-4144.
Yes, ma'am.
And that'll get to you.
That is correct.
Okay, good. And then you can help them with whatever, kind of talk to them about their insurance and figure out what it is, what steps they need to
Yes,
do.
I'd be glad to.
Okay,
Yes.
that'll be awesome. You know, we were talking earlier in the show about ResMed and the different equipment, that's how far equipment has come in the last, 17 years that you've been doing it.
Right, right. It has.
What kind of things, I mean, do you think that it have been the major improvements in sleep studies?
I think, you know, the whole field has evolved. From research, they're finding how more and more sleep apnea is affecting other parts of disease processes, like heart disease and obesity and depression and bipolar, Alzheimer's and Parkinson's disease.
Wow.
They're just finding a whole lot more through research how it's connected.
And sleep affects all of that.
But not just research, but the whole field as a whole. Technology has improved significantly. You know, the CPAP masks, the CPAP machines, they've all improved so much.
Well, I know from, like I said earlier, for myself, even when my first sleep study I had done, and then the second one, and the new machine I have now is more compact and easier. It goes in this little carry case that I can take right on the plane as a carry-on, and it looks just like a briefcase or a purse.
Very true.
So it's easy to take with me, and as I mentioned, I don't go anywhere now without my CPAP.
Yeah,
I love that little guy. I look like a snuffleupagus, but that's okay. My husband loves it too. Believe me, like you were saying earlier, that it's the spouses a lot of times.
The spouses love it so much because they can finally get sleep.
Right.
And the husbands or wives like it because they can finally get to sleep again with their spouse.
Yes,
so
yeah. And it's almost like you were saying earlier too, it's a quiet machine. It's almost like white noise. That's what my husband compares it to. It's just a steady, solid noise versus my snoring and stopping breathing. That's what would wake him up in the middle of the night.
And I think another important thing worth mentioning too is the awareness to the public how important this is to correct, because it's a growing epidemic nationally. And I just read recently on the computer where 3 air traffic controllers fell asleep. Okay.
Yeah, I remember reading something about that.
And then not too long ago, 2 pilots, they overshot their I guess they fell asleep. They overshot their landing approach by 150 miles. They suspect they went to sleep. So that, you know, safety's an issue.
Yes,
especially, I get a lot of truck drivers in here and they can't go back on the road until they get their sleep apnea corrected. So they're pushing a lot of weight down the road if they fall asleep. So it's a major concern today.
It is. And again, going back to the equipment, and I had shared with you during the break that I live off the grid, you know, using solar and wind and a generator for backup, and ResMed even has a battery pack that I use. So these truck drivers, when they're traveling, you know, there's really no reason now that you can't have the CPAP with you wherever you go.
That's correct. And even if you go to Europe or overseas, they've got adjustable
for the different
voltages.
Power sources that they have, voltages that they have in Europe. So that's good to know too. Because like I said, I have to have my CPAP now. It's my next best friend after my husband. I do put him first. But so what other things are there, do you think, about sleep apnea that an average individual would need to know?
Well, I think the seriousness of the disease process itself and how it's connected A lot of people kind of put that off, and they think snoring's an okay thing.
Right, or everybody snores a little bit.
Yeah, you know, and depending on the severity, you know, of course, they shouldn't wait 10 years to treat, because they end up having high blood pressure, hypertension, possible stroke. I know myself, I had sleep apnea, and of course I tried the CPAP, you know, and eventually I went to Dr. Ramirez up the street and had the surgery, and I sleep like a baby. Now,
and you don't need the CPAP anymore, because that was, I was going to ask you, can you ever get over sleep disorders?
Sleep apnea, probably not unless it's treated surgically.
Okay.
Or there are dental devices out there too. There's a few dentists here in town that can treat you with a dental device that extends the jaw forward. But the CPAP machine, you would need to wear it indefinitely.
So, and I guess we haven't really talked about that, what causes that sleep apnea, but you kind of referred to it here, and I know it has something to do with the muscles in the back of your throat relax kind of too much, or?
There's several variables.
Okay.
One, the structure, the jaw structure, or the soft palate can be very narrow, where you're getting less air into the lungs. It could be what we call retrognathia. That's where the chin is kind of recessed back, pushing weight on the back of what we call the pharyngeal arch and the tissue in the back of the throat. And that can actually close off the airway. A thick tongue can actually fall back and close the airway off. Enlarged tonsils, adenoids. Those are just some of the things that can...
And those are things that might be able to be fixed through surgery, or like you said, a mouth piece or something.
Correct. I might add too that weight is a contributing factor, but it's not always the case, because I see a lot of really thin people with sleep apnea. But it is a contributing factor because it pushes weight upon the diaphragm, and you get less air. And also deviated septums can cause a restriction of air into the lungs too. So.
So doing it's one of those circle kind of things. If sleep apnea or sleep disorders can cause you to gain weight or to eat more unhealthily, but then the more you eat, the more you need. It's like a vicious circle you get into there.
It is.
But I know I've shared that since I've lost quite a bit of weight myself, that it's helped in a lot of different ways, and I'm still not ready to let go of my CPAP, though. I don't think. It's a good.
We do have a very nice facility too.
Yes,
in case,
absolutely.
You know, I'd like to tell the public, you know, if you do come in for a sleep study, it's very comfortable. We have a wonderful staff. They're just excellent with patients. You know, and we operate 6 days a week. We'd like to operate 7 days, but it's not so much, it's finding technologists to work that kind of scares. But we're operating right now 6 days a week.
Great.
And,
very good. And I know they have breakfast waiting for you when you wake up in the morning.
Sometimes.
Sometimes.
It all depends. We usually get the patients up around 6. Cafeteria opens up at 6:30. But
so you can go over there and have your coffee and wake up.
We do offer coffee in the morning.
That's good. Yeah, it takes me a while to get going. If I don't have my coffee, I could be in serious trouble. So again, that phone number, Mark, for them to call if they have questions or need more information. 928-692-4144. 692-4144 if they have more questions, and you can walk them through that process.
Yes, ma'am.
Okay, and like I said, I'm a big supporter of it, so I recommend it highly. And we're really excited that you joined us this week, and I hope you learned some more about sleep disorders, and stay tuned for next week and we'll see what's coming then.